Hello, professor in class. Today I will be doing my week 3 discussion. So here we have our patient, which is this obese 67-year-old black female that presents to the ED complaining of chest pain that started last night and did not improve with an antacid. Patient has a history of a cardiac murmur, hypertension, diabetes, and high cholesterol, which of course are all um, risk factors. Patient also smokes a pack of cigarettes a day for the last 23 years and has a family history of her mother, which has diabetes, hypertension, and CAD, and her father, which had AFib and a cabbage times 3. All of these are risk factors as well. So after looking at her subjective data, I came up with acute coronary syndrome. Of course, whenever you hear of a patient having chest pain, the first thing that comes to mind, is an MI. But after reading a little bit further and looking at her objective data, what really caught my eye was the heart sounds, which were auscultated irregular with hollow systolic murmur heard best in the apex that radiates to the axilla. So once I researched that, the first thing that came up was mitral regurgitation. So that is a cardinal sign of mitral regurgitation, which led me to then change my differential diagnosis to that. I did use 2 articles that are peer-reviewed, one on mitral regurgitation and one on chest pain to get my data. I would like to run further tests and ask further questions to the patient to solidify my information before actually diagnosing and treating the mitral regurgitation. As I mentioned in my discussion post, I would like to ask more things like, specifically the onset of the pain, the exact location. Can they pinpoint it with their finger, or is it like a generalized location? How long does the pain last? The character of the pain, is it sharp, dull? Is it constant? Is it intermittent? Any aggravating or alleviating factors? I know she mentioned that, she really didn't realize if the pain got worse with palpation or movement. But I would like to dig in further into that. I would also like to ask if the pain is radiating, to anywhere in the body, to the arm, to the shoulder, to the chest, to the belly, anywhere else. Also, timing. How many times do they experience the pain, and for how long does it last? Has it been continuous since last night, or does it come and go? All these clues will help better diagnose the patient and treat the patient as well. I would also like to ask, does she have shortness of breath? Does she feel fatigued, tired, palpitations? Does she feel like her heart is skipping a beat? Any coughing, any fever, nausea, or vomiting, any calf pain or swelling, any recent illness, anything like that. Any other information than what was given would help me further diagnose the patient. Lab-wise, I would like to get an ECG to make sure that it's not an MI. And also, I would like to do a chest x-ray, and I would like to do blood work as well, CBC, BMP, and a lipase, and further troponin levels to make sure that 0.01 is in fact, the true value, and that it's not rising. And with that being said, this is my discussion on week 3, and I hope you guys agree with my differential diagnosis. Thank you.